Welcome, everyone. Thank you so much for joining us this afternoon. If you don't know me, my name is Rachel Schrader. I am the Vice President of Clinical Care and Education at Parent Project Muscular Dystrophy. And we're thrilled to have you join us today for a really great webinar from our colleagues at the University of Florida. We have Krista Vandenborn and Claudia Senesac with us today, and they're going to provide some really interesting data and information about the development of the Imaging Biomarker study for Becker Muscular Dystrophy at their center at University of Florida. So this is really cool. If you're not familiar with ImagingNMD, I believe that they will give you some background, but this is a really long-standing study that has provided a tremendous amount of insight into the natural history and progression of Duchenne. And they're really doing some fantastic work now, trying to expand upon the knowledge base that we have for Becker Muscular Dystrophy. So I think without further ado, we'll go ahead and we'll dig right in. I will say that we do have time for questions and answers at the end of our time together. So if you have questions throughout the duration of the webinar, please feel free to pop them into the chat function at the bottom of your screen. And then at the conclusion of the formal presentation, we'll pivot to a Q&A session. So with that, I will go ahead and turn things over to Dr. Vandenborn.
Thank you, Rachel, for the introduction. And I'm really excited to be here and grateful for everybody that is joining the webinar today. A special thanks to PPMD for giving us this forum to introduce what's for us a new study focused on the development of imaging biomarkers to accelerate therapeutic development in Becker muscular dystrophy. The path to move a drug that is being tested all the way from cells or animals through the different phases of clinical trials can be a very lengthy and complex process. And there are a number of reasons for that, but one area that we have really focused in on is the need for sensitive outcome measures. So these are measures that can quickly detect a change, whether that is because of disease progression or it is because a response to a therapeutic intervention. So in our community, we have really developed an expertise in magnetic resonance imaging. So our approach has been to develop MRI measures. As we already heard earlier by Rachel, we were very fortunate that we received a large grant from the National Institute of Health that allowed us to start a very comprehensive multi-center natural history study in Duchenne muscular dystrophy. The study was started in 2010, and we have now collected MR data in 183 boys with a total of 2,000 subject visits. So it's really a very rich data set. So today I'll be sharing with you some of the knowledge that we have gained and also how we are starting to leverage these data and the information that we have learned to now develop biomarkers for Becker muscular dystrophy. So when we're thinking about MRI in Duchenne or Becker muscular dystrophy, it's important to realize that we cannot see dystrophin. So we cannot see the protein that's the primary cause for Duchenne and Becker muscular dystrophy. But we are sensitive to a number of secondary processes that happen in the muscle tissue as the disease progresses. MR is sensitive to muscle damage, inflammation. We can measure changes in muscle size with muscle wasting. And as I'll show you, we can quantify the replacement of muscle by fat. Seeing the disease or the pathology in muscular dystrophies by MRI is actually pretty easy. So here what you see is on the left side, this is an image of a healthy control. And on the right side, we have an image, this is through the upper leg of a child with Duchenne. So normally on this type of MRI, the tissue should be very homogeneous. So the signal should be pretty consistent. And you can see, of course, that in the child with Duchenne, when you look at these quadriceps muscles here, that there are these bright regions. And that's simply because the muscle has been replaced by fat. So the challenge is not to see it. The challenge is how do you measure that? And how do you measure change in the disease process? And so the focus of our team has really been to develop measurements that are trustworthy, that give us the same answer at any magnet that we use, that are sensitive, because that way we can do smaller trials or we can do trials in a shorter time frame. And ultimately, our goal is to really be able to replace muscle biopsies by having this non-invasive approach. So there are two different ways that one can measure fat inside of a muscle. One is using proton spectroscopy, and the other one that I'm going to focus on today is the use of what's called Dixon imaging. So essentially what you do is you take two images. You have a water image here, and on the right side, you have a fat image. And when you combine these images, you now get a truly quantitative map. So we measure fat fraction, which is defined as fat over water plus fat. So in these maps, each pixel in that image now is a truly quantitative value of the fat fraction in that pixel. And so that's the theory, that's the approach that we're taking, and other groups are taking a very similar approach. So just to show you the infiltration of the muscle by fat over time, I'm displaying here Dixon images that have been acquired in a young boy with Duchenne muscular dystrophy that was enrolled in our study. And we followed this young man over 6 years. So here on these images, we have now displayed fat in green, so lipid and fat, and then water as red. And so the water is primarily derived of muscle. So if you look at this young boy at the age of 7.5, and these are now images of the lower leg. So these are the calf muscles in the back. And I want to point out the soleus muscle because it's a muscle that we have really carefully characterized, and I'll come back to that a couple of times. So here, if you look at the calf muscles, you can see that overall it's mainly red. There's a little bit of green here at the bottom. And then as the boy comes back at each follow-up visit, you could see that once that the boys are around the age of about 10 years old, you can see there's much more fat infiltration. And in fact, you can see this rapid replacement of the muscle by fat. So at this point, we have really characterized this disease progression or this quantification of fat fraction in a large cohort of boys. And so this slide here shows you kind of a summary. In this case, we're displaying fat fraction that was measured in one of the quadriceps muscle, so the vastus lateralis. So here, this is again the upper leg. The front is the quadriceps muscle. And this is one muscle we have carefully measured. So on the left side shows fat fraction measured in this quadriceps muscles in the different age groups. In yellow, you see healthy control boys. In light blue, you have boys with Duchenne at baseline and then 1 year later. So first off, you can see that the fat fraction, particularly when you look at the older boys, is much higher in a child with Duchenne compared to an age-matched control. And you can also appreciate that we can detect the changes over the course of just 1 year. So even in the youngest boys, we can still detect the change over 1 year. So really supporting the idea that MR measures of fat fraction are highly sensitive to disease progression. On the right side here, we have another summary slide, but now what we're showing is individual data points. So these are data acquired of all of the boys. Again, fat fraction on the y-axis versus age. And each of these dots represents a data point of one of the boys. So there's two main points that I would like to bring your attention to. First off, you can see the progressive increase. And it almost follows kind of this S curve, right? Within the beginning here, very slow progression. And then once the boys are about 10 years old, you can see this rapid increase until it slows down again simply because the muscle has been replaced by fat. The other point that I would like to make is the variability across subjects. So you can see some of the boys here at the bottom, in which the fat infiltration is relatively slow, and in other boys where this happens much more rapidly. So overall, we know that fat fraction increases with age, and there is a lot of variability in the rate of this increase. Now, of course, as you can imagine, MR measurements are really expensive. So if we're going to introduce a technique such as MR, we really want to make sure that it is more sensitive than the current techniques that we have. So we compared the MR measurements with some of the functional endpoints, and we were particularly focused here in this slide on the 6-minute walk test, which is, of course, a functional endpoint that is commonly used in clinical trials. So one of the key questions that we had was, do MR measures detect disease progression when the 6-minute walk does not? So in order to address that question, we grouped all of the boys in one of 4 categories based on the change on the 6-minute walk test in 1 year. So we have one group here defined as Q2. These are the boys that essentially were stable. They did not show a change in fat fraction, change in the 6-minute walk test over the course of 1 year. This is another group here, the Q1, that we think is an important group to focus on. These were the boys that actually had an improvement on the 6-minute walk. And that's not uncommon to see in boys when they're really young, so between the age of 5 to 7. So our question was, can we still see changes in these boys that are either stable on the 6-minute walk or that show a slight improvement? And the answer is yes. You can see here the changes in fat fraction for the boys that improved on the 6-minute walk test, and here the changes in fat fraction for the boys that remained stable. So these data demonstrate that these MR measurements are indeed quite sensitive. The next question, of course, that was important to address is, are they responsive to treatment? And so the way that we approach this is by looking at corticosteroids. We know that in the Duchenne population, corticosteroids slow the loss of ambulation by about 2 years. So we wanted to see whether we would be able to detect the effect of corticosteroids. And we did that in 2 different ways. So on the left side here, we looked at changes over just 1 year in fat fraction. This was done in a very young population. So these were all boys younger than 8 years old. And we compared boys that were on corticosteroids, so they were treated with corticosteroids in blue, versus the boys that remained corticosteroid naive. In other words, they did not take corticosteroids. And you can see for the 2 muscles that we measured, the soleus, which is one of those calf muscles, and the vastus lateralis, which is a quadriceps, we could clearly detect a difference between the boys that were treated with corticosteroids versus the boys that remained corticosteroid naive. A clear difference in the change in fat fraction. As we pointed out earlier, at this point, thanks to all of the families that have participated in the ImagingNMD study, we now have a very rich data set, which allows us to model the disease trajectory and the effect of corticosteroid over the entire natural history. And so here, if you look at the graph on the right side, we plotted fat fraction as a function of age as measured in the calf muscle, the soleus. And so we had 2 groups. We have the boys that were corticosteroid naive throughout their time in the study, so in red, and then the boys that were treated with corticosteroids throughout the course of the study. And so you can see again this S-curve that I showed earlier, but you note the difference in the slope. You can see that there is a clear shift to the right if you compare the boys that were treated with corticosteroids versus the boys that were corticosteroid naive. In fact, note that the age at which 50% of the muscle was replaced by fat was about 13 years old in the boys that did not take corticosteroids versus about 18 and a half years old in the boys that were treated with corticosteroids. So these data really show the effect of corticosteroids on fat infiltration as measured by MR. Now, from the FDA's perspective, it's valuable that these measures are sensitive and that they're responsive, but ultimately it's really important that they are clinically meaningful. And so in order to address this question, at the same time that we do MR measurements, we also ask each of the boys to complete some of the functional performance tests. And the 4 measurements that we've really focused on a lot is the 10-meter walk run, climbing stairs, getting up from the floor, and the 6-minute walk test. So these are tests that are commonly used in clinical trials. And so first what we did is we looked at the relationship between performance on these tests and fat fraction. And so here you can see performance on the 10-meter walk run versus fat fraction, showing a strong correlation between fat fraction in the muscle and performance on, in fact, all of these functional tests. Next, we also looked at the relationship between fat fraction and whether or not you still have the ability to perform the test. So here, what you see on the bottom here on the right, you have the proportion of boys that can still complete these tests as a function of fat fraction. So in green, we have getting up from the floor, in red, stair climbing, and in blue, walking. And so you can see that as fat fraction increases, the number of boys that can still complete these tasks decreases. So overall, what we found is that the MR measures both correlate with performance on functional tests as well as predict loss of function. And so that makes the measurements really valuable to be used in the context of clinical trials. So at this point, these measurements are being used in a number of clinical trials in Duchenne muscular dystrophy, and I've listed some of the trials here. That is in phase 1, phase 2, and phase 3 clinical trials. We have also expanded our network from 3 sites to now 30 sites across the United States and Europe to support clinical trials in general in muscular dystrophies. So at this point, we would really like to leverage the data that we've acquired, the knowledge that we've gained to help develop MR biomarkers to accelerate therapeutic development in Becker muscular dystrophy. This is really an exciting time for Becker muscular dystrophy, with a number of pharmaceutical companies really targeting drug development for this population. And so there are a number of compounds, and I've listed some of them here, that are now moving through these different phases of clinical trials. Several of the studies are either using or considering using MR measurements. In fact, we are currently collaborating with Edgewise in a phase 2 clinical trial. And so it's really important for all of us to really understand the natural history and the disease trajectory in these different muscles, and to develop measurements that are sensitive. And so obviously, in trying to approach this, there are some differences between, of course, Duchenne and Becker muscular dystrophy that we have to really consider. First, as we know, is that, of course, that the patients have not an absence of dystrophin, but abnormal levels or low amounts of dystrophin. We know that the population is smaller, so recruitment becomes even more challenging, which is one of the reasons that we really appreciate the opportunity today to talk to you directly, because in order to do these studies and understand the disease, we really need patients to participate and to be part of our community and help solve this. We also know that the disease is slower. So as a consequence, we need even more sensitive measurements, and there is even more variability in the disease trajectory across subjects. What I'll not be discussing today, but there is a study underway looking also at cardiac involvement in Becker's patients with in Becker muscular dystrophy. So in this study, that is an expansion of the Duchenne study, we are now looking at taking a very comprehensive approach. In addition to making localized images, we are also using whole body imaging, and we're doing respiratory imaging. In conjunction with the MR measurements, In the same way as we have done in the Duchenne population, we will be doing functional measurements so we can look at the correlation, and we're collaborating with the GRASP consortium on some of these measurements. So some work has been done using quantitative MRI in Becker muscular dystrophy. In particularly in Europe, there's been some nice studies. This is here a summary slide from a paper that was published in 2020, showing fat fraction in all of the leg muscles here, using a very similar approach. So you have, again, fat fraction as a percentage in the different muscles. So the first thing that you see is that there is indeed a lot of variability. So some muscles, such as the muscles here on the right, the tibialis posterior, have very little fat. On the other hand, if you look, for instance, here, the biceps femoris, it has significant fat infiltration, very similar to what we see in Duchenne. But there's also a lot of variability across the different patients. So next, I'm going to show you some of the images that we have acquired using Dixon imaging at our site. And so here are images acquired in 6 patients with Becker muscular dystrophy. And I'll present a series of images. They've all been displayed in the same way. So here we have on the left side, the top, a 21-year-old young man with Becker's with a very mild phenotype. You can see that he has a high performance on the 6-minute walk test, over 550 meters, and a perfect score on the North Star. This image is acquired of the upper leg. So we have here the quadriceps in the front, and in the back, we have the hamstrings. So overall, there's very little fat infiltration in this muscle. In fact, it does not look very different from what a healthy muscle looks like. On the other hand, here we have an 18-year-old. All of these men are ambulatory, so they're still walking. And so here you can see significant fat infiltration inside of the muscles. A more variable pattern here in this 28-year-old. But overall, the point that I would like to make is that there is significant fat infiltration in the upper leg muscles, although it's variable across the different subjects. The next slide here shows you images now acquired of the lower leg. So here, same exact men. So here we have the calf in the mild phenotype. We can really see very little or no fat. If we see here across, in general, you could see that the lower leg muscles are more preserved, which is consistent with what we know in both Duchenne and Becker muscular dystrophy, that typically the larger, more proximal muscles are affected first, followed with the more distal muscles. You can also see the heterogeneity across the different muscles. For instance, here you can see the tibialis anterior of this individual is completely replaced by fat, whereas here in these 2 gentlemen, the muscle is almost completely preserved. So there's a lot of heterogeneity and variability. So what do we do with that? How do we handle this? Well, one approach is to really take advantage of the variability across the muscles and to take a combination of muscles maybe rather than an individual muscle. So this is similar work that was done and that's been published by our colleagues in the Netherlands at the University of Leiden, where they quantified fat fraction in all of the leg muscles and then looked at which muscle is the most sensitive of what combination of muscles. If I bring you back to that earlier S curve, right? We have the beginning here, we have slow progressing, then we have fast, and then we have slow. So if you identify muscles from a biomarker development, the ones that aren't changing is not going to be valuable. You can't measure anything. If the muscle is replaced by fat, it's not valuable because you're not measuring change. So you really want to have muscles that are kind of in this green zone, okay? And so that's the approach that we're currently pursuing, trying to find a combination of muscles. And this was successfully done in a recent clinical trial. This is a clinical trial in Becker muscular dystrophy that was just completed by Ital Pharmaco, was the sponsor, looking at the effect of a compound that's called Givinostat. So they had one group of patients that was treated with givinostat and the other group that was the placebo group. In this study, where they performed muscle biopsies, they also performed different functional tests, including the 6-minute walk, and they measured fat fraction in the whole thigh as well as in the whole quadriceps, so using a combination of muscles. And they found that while there was no difference in the muscle biopsies, or we could detect no difference on the functional endpoint, we did see a difference in the treated group versus the placebo group following the treatment of givinostat. So we feel that this approach of maybe combining muscles will be very valuable in Becker muscular dystrophy. Next, we're starting to look at arm muscles. We don't need to limit ourselves to maybe leg muscles, but maybe there's other muscles that may be valuable. And we really don't know a lot about the arm muscles. So here again, these are the same exact patients that I showed earlier, with again in the left, the 21-year-old with a very mild phenotype. Here in the front, we have the biceps, and in the back, we have the triceps. And then here we have the other individuals. You can see this 28-year-old, also very preserved muscles, and then a bit more variable across the other patients. So we think there's value in maybe combining the arm and the leg muscles in trying to develop the most sensitive measurements. And then finally, we are starting to look at respiratory muscles. We know that BMD patients are at risk for developing respiratory dysfunction. So this is here a summary slide by a paper that was published by a Japanese group in 2020, where they looked retrospectively at the medical records and particularly the pulmonary function tests that were performed in a group of patients. And they found that about 20% of the patients had a forced vital capacity below 80%. This was independent of the cardiac function, independent of age or ambulatory status. So we have started to look at respiratory muscles, and we're doing that in two different ways. Ideally, we want to measure the diaphragm, right? It's the most important respiratory muscle, but it's very, very thin, so it's difficult to measure. So instead, what we do is we look at measuring fat infiltration in accessory respiratory muscles. So those are the muscles that help the diaphragm. So we think that's a very valuable approach. This was developed by Glenn Walter looking at Duchenne muscular dystrophy, and we're now expanding that to Becker muscular dystrophy. So in this case here, there are three muscles I would like you to focus on. So this is now a cross-section through the mid-belly. So here's your belly button up front, here's your back. And so these are the three muscles I would like you to focus on. So the external oblique, the EO, the internal oblique, and then this little sliver here of transverse abdominis. On the top, we have an image. This is again the same kind of Dixon image, showing in green fat and in red the muscle. Of those three muscles, you can see all three sitting there. On the bottom here, we have the same exact image acquired in a patient with Becker muscular dystrophy with a forced vital capacity of 89% of normal. And so here's this same area. So we see these two slivers, but you can also appreciate that the internal oblique muscle here has significant fat infiltration. And so these are muscles that have proven to be valuable in Duchenne. And so we will also be focusing on these measures in the Becker muscular dystrophy population, again, with the goal of defining the most sensitive measurements that will be valuable in clinical trials. The final technique that I want to show is, rather than using these static images, you can also take images while we are breathing. So this is a cine MRI, where essentially take images as the patient takes a deep breath, so deep breath in and a deep breath out. And so we'll look at the changes in the thorax and the pulmonary cavity as another potential strategy to look at pulmonary function in this patient population. So at this point, I am going to hand it over to Dr. Sinisek. She is the project manager for ImagingNMD. She's really been a terrific advocate in helping recruit patients for the Duchenne study. And so she is at this point really trying to reach out and really recruit Becker's patients to this study. So Claudia, I'm going to stop sharing here and going to pass it on to you.
All right. Thank you. All right, let's talk about how you can get involved in this study. So if you could advance to the next slide. I don't think I can do that from here.
Yep.
Thank you. So what are the benefits to you by participating in this study? So Dr. Van Born has outlined for you that one of the benefits of this study is that this study will comprehensively map out the disease progression of Becker muscular dystrophy. It will also determine those biomarkers that are beneficial for clinical trials to be developed. Excuse me. In addition to that, it will provide pharmaceutical companies information to help them plan effective clinical trials. It will provide drug companies natural history data in place of placebo groups. And then aside from that, something that's different with the natural history study is that we can share the data that we collect on you as a participant. And we do that. We share the data that we collect on while you're here on a visit. So the images that we collect, the functional data that we collect, we share that with you. We put some of the images on a flash drive or on a thumb drive. We mail that to you, and we make arrangements for the principal investigator to sit with you on a Zoom call virtually and go over those images and explain to you what we saw in those images. And that's something that's really different about a natural history study. In clinical trials, they're not allowed to do that because they're protecting the data as a whole. Next slide. Well, you'll need to know what the inclusion and the exclusion criteria is for this study. The inclusion criteria is you need to have a diagnosis of Becker muscular dystrophy. We are recruiting men between the ages of 18 and 62 years of age, ambulatory and non-ambulatory. We want a wide cross-section of men participating in this study. And you have to be medically stable. Probably more importantly are what are the exclusion criteria? You can't have an internal defibrillator or a pacemaker. If you are on a ventilator full-time, that would exclude you from this study. If you are using non-invasive ventilation, but you have to be on it all the time during the day, and you couldn't come off of it for an hour to be in the magnet, that would also exclude you from the study. If you have back pain and it prevents you from lying on your back for an hour, then you wouldn't be able to participate in this study, because in order to get into the magnet, you would need to lie on your back. And we do position you as comfortably as possible. There would be a pillow under your head. We would put a pillow under your legs just to get you positioned comfortably so that your back is flat. But if you can't tolerate that position, then that would exclude you from the study. And then the last thing would be contractures, tightness in the muscles, primarily of the lower leg, tightness behind the knee, tightness in your hips, and mainly due to the fact that the magnet is very small. The actual tube that you go into the magnet can be restricting. And so if we have a question about that during the screening, then we would do a Zoom call so that we could assess how much tightness you have in your hips and behind your knee to make sure that you would be able to fit into the magnet. Okay, the next slide, please. There is a screening process. So prior to enrolling, prior to you actually coming to one of the sites for the study, we would put you in contact with one of the coordinators. And I'm the coordinator here at the University of Florida, and we have a coordinator at OHSU in Portland, Oregon. There's a short telephone screening that we would go through with you over the phone, and we're gathering information to determine your eligibility. That information would be demographic information, your medical history, your function, and as I alluded to in the previous slide, do you have contractures? If we need to do that Zoom call to assess those contractures, we'll set that up. Have you had any major surgeries? Have you had any major injuries? What medications might you be on? Just general information. And then we want to address any questions that you might have about the study. We want you to really understand what you're signing up for when you sign up and enroll in our study. Next slide. And then we also want to explain to you what the study covers and how many visits are entailed in this study. So we cover all traveling expenses and lodging for you. We pay for that up front. We don't want you to have the burden of paying for that and then going through a long process to be reimbursed for that expense. So we cover that for you. You are also, in addition to that, you are also paid $500 over the course of 3 visits. Essentially, this study will be 3 visits. There will be a baseline study, and for that study, for that visit, you will be paid $100, and that's considered year 1. A year from that visit, that would be considered your second visit. You would be paid $150. And a year from that visit, that would be your third visit and your final visit, and you would be paid $250 for that visit. Next slide. During these visits, what happens during these visits? What will you be asked to do? And again, Dr. Vandenborn has talked about this in her presentation, but just to review it with you, you will have whole body and localized imaging done of leg and arm muscles, as well as your respiratory muscles. In addition to that, you'll have some functional testing done. And that functional testing will look at things like how mobile are you? What is your range of motion like? What is your strength like? If you are walking, there will be some walking test. What is your arm function like? There'll be respiratory testing, pulmonary function test, which you've probably had done in a clinic setting at some point. So breathing test. On the second visit, there will be a muscle biopsy done, and this is a needle biopsy. You will not be put under anesthesia for this biopsy, and we will be sampling a muscle in your upper thigh and in the lower leg. We use the first visit to locate the muscles that we will be doing that biopsy on, and that's why we use the second visit to do that. This is a one-time test that we do, and we're comparing the sensitivity of the biopsy with MRI. And then, of course, every visit when you come, we want to update the medical information, your medications, and anything that has transpired between your previous visit and your current visit. And the next slide. So The study, the name of our study is Magnetic Resonance Imaging and Biomarkers for Muscular Dystrophy. We are looking and enrolling men with Becker Muscular Dystrophy. This study uses magnetic resonance imaging, or MRI, and spectroscopy to examine muscles in adult men with Becker Muscular Dystrophy annually for 3 years. We're looking for individuals between 18 and 62 years of age that have Becker Muscular Dystrophy. And if you're interested in this study, I really want to hear from you. I want you to call me or email me, and I would love to tell you more about the study. I want to answer your questions. I want to help you in any way that I can. So please get in contact with me. And the next slide. This is our combined team from an annual meeting that we had out in Portland. And you can see that it really does take a village to, to look at all of the things that we do in this study and in the studies that we have been involved in for the last 15 years. We want to hear from you. We're really excited about this study. We think that this is going to help the community learn a lot about Becker Muscular Dystrophy. Thank you so much.
Thank you, Krista and Claudia. That was just fantastic. Clear, concise, helpful, informative, really, really great. So I think at this point, we'll go ahead and pivot to the question and answer session. So if you have questions for Krista or Claudia, please put them in the chat, and then we'll go ahead and share those questions and answers. And I have a couple of questions of my own that came up as I was listening to your presentations, but I do see that we have a question here in the chat that I think we can start off with. And that is, have you published a brief note somewhere so that I can share it with the community? So is there a written resource somewhere that summarizes this study that could be shared more easily? And where would we find that?
That's actually a really good question. We clearly have a flyer brochure that we can send out. We're also updating our website as well, so we can direct people to the website as well. So maybe what we can do is maybe after this meeting, Rachel, if we can distribute it to you, would that be helpful? Can that be shared further then?
Absolutely. And PPMD always makes these recordings available for re-watching at a later date if you either want to go back and listen to it again or would like to share it with a friend or a family member. So this will be available on our website in the coming days. And we can also, create some written context around that as well with a summary of those inclusion and exclusion criteria. So between the two of us, we'll make sure that we've got it available in multiple locations so that it's really accessible for people. Okay, so this next question is in regard to this whole body imaging protocol. So do you also scan cardiac muscle within this protocol? Can you give us a little bit more detail there?
Yeah, so typically when you do whole body imaging, you don't look at cardiac muscle per se. That's a different type of sequence that we do. So we don't currently do it as part of this study. However, my colleague Glenn Walter does cardiac imaging and has another study that looks at cardiac imaging. I believe right now it only has a small population of Becker's patients that he's looking at, but I anticipate that at some point we will be expanding to cardiac muscle as well, because we do that also in Duchenne.
Excellent. And maybe what we can do too on the PPMD side, when we push this written and recording resource out, we can maybe include some information about some of the other currently open imaging protocols that are underway.
Yes.
So a question that I have for Claudia. So you shared the financial support for getting folks to your clinical site. Does that cover the ability to bring either a significant other or a caregiver along with the person with Becker?
Thank you so much, Rachel, for bringing that up. Yes, if the individual with Becker muscular dystrophy needs assistance for traveling, we do cover reimbursement for travel for an assistant or, a loved one to come with them to assist them. Absolutely.
Perfect. I had a feeling, so I wanted to make sure that we called that out for everybody. I know it can be tricky to travel on your own, particularly if you've got limited mobility, and it's always great to have that support person with you. Okay, so here's a really good question about positioning in the scanner. And I know that you have so much experience with this. So how do you position people for the whole body scans? And do you have any recommendations regarding comfort? I know you mentioned people that have severe contractures can sometimes have a really tough time getting in the magnet, but what about people whose contractures are mild to moderate or just otherwise uncomfortable? I know those MRI scanners can be a little bit uncomfortable.
We have a number of different pads and straps that can help us with positioning. We're really quite diverse in what we use in the magnet, and it's really individualized for each person that's in the study because no two people are alike when it comes to positioning. There are certain things that we have to keep in mind when we're positioning because we are trying to get particular muscles and alignment for imaging. But it's really critical that the person is positioned comfortably so that they can lie still while the imaging is taking place. So we're really keyed into that. We use sandbags. We use pillows, we use towel rolls. We have a variety of, as I said, different types of pads that we use. And we always try and bring the surface to the person's body. So we want everything to be in contact with the surface so they don't feel like they have to support the body part with their muscles on, if that makes sense. We don't want them to be tense while they're in there. We want them to be as relaxed as possible. And in addition to that, we either set up a movie for them to watch or listen to music while they're in there so that they can be more relaxed. And if they prefer, we also have one of our trained people on our team to be in the magnet with them.
Not
that's fantastic.
In the magnet room.
In the magnet room.
Clarify.
Yes.
Those magnets got really big. So you guys really are so particular in making sure that the people are comfortable in the magnet. How long would somebody expect to be in the magnet? And then how long would a visit actually take from, the scanning and the physical therapy assessments? What does that time commitment look like for a family?
Again, that's a really good question. We like to space the visit over 2 days. And part of why we do that is we don't want our subjects to be fatigued. It's really important that we don't try and squeeze too much into one day. So often the subject will arrive. And I'll just give you an example. Let's say we're going to do a Monday, Tuesday as our testing days. So we might have them come in on Sunday afternoon. We would meet them on Monday at valet parking. We'll bring them down to where the magnet is. We'll do consenting on that day where we're actually signing the papers that say they will participate, agree to participate in the study. They will have some imaging done on that day. And that first imaging session is usually about an hour and a half. We block off 2 hours, but the actual time period is probably an hour and a half. And then the next day they come back, they're met again at valet parking. They're taken down to where the imaging takes place. Again, we go through MRI screening before they go into the magnet. They're there again. We have a 2 hour block of time. They have more imaging done. Then they have a little break as they're taken over to our other building where we do the functional testing. Again, we have another 2-hour block of time at that facility. They do functional testing, and then they're followed by pulmonary function test. And then there's a certain block of time for that. I think that's about an hour. So there are breaks in between this testing. Again, we're really cognizant that individuals with muscular dystrophy get fatigued. And we want to make this as relaxing as possible and not fatiguing over the course of these 2 days.
That's really, really helpful, Claudia. Thank you for giving us some more insight on that. So I have kind of a 2-part question for you. So we have a comment in the chat from a parent that I think is really interesting. She's talking about her son who's almost 18. So if you are a teen living with Becker, or you have a teen living with Becker in your home who is approaching 18, could they reach out to you to start the process now? And are there any plans to expand to a protocol to include the under 18 Becker population?
Yes, there is. And actually, our colleagues at Edgewise are very interested in looking as young as 12 years old. So we will be expanding the study to look at younger men as well.
Fantastic. And Claudia, is it all right if they go ahead and reach out to you now and get the process started?
Yes, please do.
Perfect. All right, this next question, I think it might be PT speak because I'm not sure what it means, but I'm going to ask it anyway with the assumption that you know what it means. Are you taking any diffusion acquisitions or thinking at all about using diffusion in any way?
That's MR speak.
That's
MR speak. It's a good question.
So it is a good question from Tina here. So at this point, we're not doing diffusion acquisition. I mean, it's a valuable measurement. We really have to prioritize. As you can see, we do a lot of measurements already. And so early on in our ImagingNMD study, we tried different sequences, and we really narrowed it down to making it being sequences that, one, we think are possible at all sites, with giving you the same answer at all of the sites. And so it has to be relatively simple. Sometimes diffusion acquisition can be a little bit more challenging. Doesn't mean it's not valuable. And then we have to prioritize. So I know there's other people that are interested in that. I think it's a wonderful field. But for us, that's not data acquisition that we're doing right now.
Great. Thank you, Krista. So this next question is a question of my own. So we've been talking a lot about imaging Becker. Obviously, the target audience for this is Becker. How are you defining Becker? Is this an age loss of the ambulation? Is this dystrophin on biopsy? Is this mutation specific? How specific are you getting when we're talking about classifying Becker versus Duchenne?
Do you want to take that one, Claudia? It's a challenging one. And so
it is very challenging. Right now, during recruitment, what we're asking for is a genetic test that has stated that they have Becker muscular dystrophy and not Duchenne.
Okay. So I guess my question would then be for people who have a genetic report that suggests Duchenne, but they are 25 years old and quite mobile, when we're thinking about these discordant phenotypes, what about somebody like that? Would they be excluded, at least in the beginning, or what do you think about that?
No, as you know, we study both Duchenne and Becker's muscular dystrophy. So our grant was actually renewed for Duchenne and Becker's. Today, we really talked about recruiting Becker's patients, but the reality is that we know it's a spectrum. We know it is more complicated. And so they can enroll in the study just as well, and we will follow their natural history. We trust that over the next couple of years, we'll have more information and that those data will actually be very valuable.
Great. So if somebody perhaps has a genetic report that suggests Duchenne, even though discordant phenotype or whatever the case, they should still reach out to you and figure out where they fit.
Yes.
Perfect. Awesome.
We will find a home. We will find a home.
Excellent. All the images. No, it's so valuable, right? I mean, it just is this wealth of knowledge that is really impactful for how we think about Duchenne and Becker and, transformative treatments in the future. So I think it's just so spectacular that you're able to reach each of these groups, particularly because I think we recognize now that it's all a spectrum, right? So this is a range of dystrophinopathy that is variable, and there's so much that we still don't know. So it's really great. Another question of my own. So the protocol now is for 3 years, years 1, 2, and 3, but we know that progression can be a lot different and a lot slower in Becker. Are there plans for a potential follow-on grant or extension study or some mechanism for, looking out 4 or 5 years or even longer for these people?
Yeah. At this point, we are funded for 3 years. But, we're always looking for additional funding opportunities. I think that based on what we've learned in Duchenne, we think these data are going to be super valuable and that there will be opportunities to expand the study. But at this point, we're only recruiting for 3 years because that's only what we can promise.
Okay, perfect. All right. And then it looks like the questions have slowed a bit in the chat. I do have one last question of my own. So you mentioned the needle biopsy. Is that a Vicora tool or what type of needle biopsy are you doing?
Yes, that's a Vicora one.
Okay. All right, great. I'm personally a huge fan of the Vicora. We used it when I was in the clinic, and it's great to see how minimally invasive that can be as opposed to those open biopsies. And being able to do it without anesthesia is just a huge, huge pro for people who are going through that. So I love that so much. Okay. Do you flash freeze the biopsy samples?
We will probably do a combination of things with the biopsy samples. I really would have to defer to Dr. Forbes, who's taken the lead on that. So I see that's a question of Tina. Tina, I can certainly get back to you personally. I know that we're trying to maximize the tissue is extremely valuable. So we will maximize the types of data that we will get from the samples. But I don't want to go into the specifics because I might say something in error.
All right. Well, I want to thank you both, Krista and Claudia, for joining us today. This has been super, super valuable, incredibly interesting. And I think I'll actually take this moment to share for the first time out loud to the community what we've been talking about, and that's the inclusion of a Becker track at our annual conference this year. We're really excited to have some Becker-specific content for families and people living with Becker muscular dystrophy. That'll be broken up into 2 separate sections within conference. We'll have one period of time really dedicated toward the clinical care of people living with Becker muscular dystrophy, and a second session that will be dedicated to emerging research and therapies that are in development targeting Becker recruitment. So we're really, really excited about this. Claudia will be there talking about this study and about other physical therapy implications for people living with Becker, and we hope that you'll be able to join us. We should be able to share registration information soon, but do anticipate that this will be available both in person and via virtual live streaming. So we hope to see you there and look forward to really continuing our efforts specific to people living with Becker muscular dystrophy. So we're thrilled to have you all here. Thank you for joining us. Like I said, this will be available to re-watch via our website, our social media channel, YouTube, all of those different resources, along with a written summary as well. And with that, I am going to allow Krista and Claudia to have the last word, and then we'll go ahead and wrap it up for the day.
Yeah, I just want to thank everybody for joining. We're really committed to help make a difference, and we are super excited to be able to move this study forward. Also, thank you again to PPMD for your many years of support.
I would really like to thank PPMD for hosting this webinar and allowing us to, talk about this exciting natural history study, which is really part of the foundation of building other studies from this data. So we're really excited about the study, and I hope to hear from some of you soon.
Wonderful. Thank you, Krista and Claudia. And with that, we will call it a wrap. Thanks, everyone. Have a great rest of your day.
Thank you.